Hi, I'm Dr. Jeffrey G. Lawson. I'm the senior rheumatologist at Piedmont Arthritis Clinic. I established the clinic in July of 1979, and our clinic has grown from that day on. We focus primarily on excellence in the care of rheumatic diseases, and with our endeavors here with the type of treatments that are available and research and other parameters, we try to make sure each patient receives the appropriate therapy for their disease. The primary treatments we treat are rheumatoid arthritis, osteoarthritis, and systemic lupus erythematosus. Some patients also will have ankylosing spondylitis or psoriatic arthritis. All of these cause discomfort in their joints, although the spondylitis can primarily cause discomfort in the back. Systemic lupus erythematosus does cause joint discomfort, but also can cause problems with the cardiovascular system and the renal system.
I've been a patient with Dr. Lawson for many years. I have rheumatoid arthritis, and Dr. Lawson's helped me from rheumatoid arthritis till I walked the Appalachian Trail 2 years ago, 2,000 miles. I was working a third shift as a supervisor and got where I couldn't walk. My left knee got to hurting and real stiff, and I couldn't function. I couldn't walk. I started taking Tylenols for the pain. Didn't know what it was. Anytime I got to the hospital, my left leg wasn't hurting. It was in my right. If you know anything about rheumatoid arthritis, it moves in your body from one place to another. It don't stay in the same place. And they had doctors tested me for all kind of diseases and couldn't find anything, and I was breaking out in sores and had a real high fever. And Dr. Lawson just happened to be there that night, and he said, "Let me look at it." And Dr. Lawson gave me some prednisone, and it was just like he opened every window in the hospital. My fever went away, and I started getting better. So he started treating me for rheumatoid arthritis, and I've been doing great since.
When I was in training in the early 70s, our primary treatment was gold injections and 24 aspirins a day. In 1998, we received access to the first biologic medication that was specifically focused on removing chemicals from the bloodstream that enhance the inflammatory response by stimulating white blood cells to attack the joints. Prior to that, we used methotrexate, gold shots, and another drug called penicillamine. We had some improvement with the arthritis, but in general, the patients had continued progression of their arthritis. Now we see patients who have onset of arthritis since 1998 who have no signs of damage to their joints. Even the patients who have had arthritis prior to 1998 and did have significant damage have no progression of their arthritis since that time.
I started here 2 years, 3 years ago, and just in that time, when I first started, there were 4 medications we were infusing. We're now infusing 10. And since we also have drug study here at our practice, I know that there's a dozen, 13 more drugs in the line that are being tested, going through human testing. So it's a real exciting time because it's in the last 15 years we've gotten new infusion medications for rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis. There's a new medication out for gout, new medication out for lupus. So, and prior to these meds, there was nothing to do except treat the symptoms. The benefits of infusion therapy is that it stops the damage being done to your joints. All these rheumatoid type diseases, all these inflammatory diseases cause damage to your joints. You probably have seen little old persons with deformed hands. Basically, that is just damage progression that is happening over a long period of time. We can stop all that damage from being done, but we can stop those hands from changing. So the sooner you get in and start doing infusion therapy, the better off you're going to be in further down the road. I mean, you know, we shouldn't be seeing those deformed hands anymore if people are coming in to get their treatments.
The trials use drugs that have already been tried in what they call phase 2 to make sure that the drugs are safe and to help determine what the dose that's most effective. We do mainly phase 3 trials, or those are the trials that are necessary to get the drugs approved for FDA release to the public. So we'll have patients who are on medications for 3 or more years prior to the drug being released to the public. So like a patient I saw today was on a medicine for 5 years that it's only been released for 2 years to the public.
I was actually teaching the concept of lupus to my students, and I came home for lunch and got the diagnosis by phone by my other doctor. Okay. Dr. Lawson and I each visit talk about what's on the horizon in terms of medications, because I was interested with my nursing background, what was out there. And there really hasn't been anything new for lupus in 50 years. And so when this drug was in development, he told me about it, and I followed it and he followed it. And he said at the same time, every other medication that I was trying really was not helping. And so I was very excited, and he said, when it's approved, when it gets FDA approval, you'll be my first patient. And he kept his word. So I was the first one in this practice to start it, and that was about a year ago.
We've invested in a small MRI scan machine that does an evaluation of the hand so that we get an accurate assessment of the inflammatory process, so that we can customize their treatment to prevent any further progression of the disease. We had a patient the other day that had an MRI scan in 2009 and then had a repeat this year, and she had one area of significant damage to the joint in 2009, and with the MRI scan this year it showed complete healing of that area.
If your doctor orders an extremity MRI, we'll be doing it on our in-house MRI machine. MRI does not involve radiation at all. Instead, it uses the radio frequency pulses and a magnetic field to create images. Some of the advantages that this in-house MRI allows us to do is especially for early rheumatoid arthritis detection. We're able to see inflammation of the synovial fluid, detect bone erosions in early RA, which would not appear on the x-ray, and have evidence of bone marrow edema, which is thought to be a forerunner for erosions. We use these images for more accurate diagnosis. We're able to evaluate for erosions, disease activity, and joint destruction from chronic inflammatory arthritis. And the comparison MRI images will allow our doctors to monitor treatment response. The extremity MRI scan takes 25 to 30 minutes. We can do a hand, wrist, elbow, foot, ankle, and a knee. And your head and most of your body will be outside the magnet, therefore you'll not experience claustrophobia. This is our bone density machine. We provide this service in office, and it allows the doctors to see exactly how strong your bones are. The test takes approximately 5 minutes, and your doctors will have the result right away. Since osteoporosis is a silent disease, the only way for the doctors to know exactly how strong your bones are through the results. This machine scans your hip and your spine. It's a very low dose radiation, and the scores are generated by calculating exactly how much of the x-ray your bones absorb. The stronger your bones, the more x-ray it's going to hold on to.
Part of what we do before we start you on therapy is we will do a benefit investigation form with your insurance company to find out if that particular drug would be covered. And we find out how that's going to be handled, whether it's going to be through a copay or whether it'll be a percentage, or how that's going to be done. Depending on what we find out after that, then we start looking at resources to help you with those costs. If you're a commercial insurance patient, usually with infusible drugs, there's a copay card that the drug company offers that will help you pay for the drug. And if you're a federally funded patient, there's foundation assistance available out there that we help you access. We do a lot of the legwork for the foundations and for the copay cards for the patient. A lot of times that requires the patient to give us their tax forms and things like that, and so it is a participative process, and the more they're involved, the quicker it tends to go. But we tend to help spearhead that effort for them and help them get through the paperwork.
I was a music major in college, so that makes it a little more interesting than maybe a science major, and taught music for a few years and then came into medicine after that. I chose rheumatology as a specialty because my uncle had severe rheumatoid arthritis. I always was aware of how many problems he had with that and his early death as a result, and I thought that the new medicines that we use for rheumatoid arthritis are so promising. They prevent a lot of the side effects and problems that he had, and indeed I have seen that in my practice. So I have that in my background, as well as I have been interested in rheumatology for other reasons because of all the autoimmune diseases, and they're mainly in women, and we still have no idea what causes them. So it's always been an interesting thing for me to treat these patients.
Well, I chose rheumatology as a specialty because I enjoy seeing patients over a long period of time and getting to know them and joining them in a partnership in their care. And that appealed to me as opposed to having patients come in and never seeing them again. So I like the idea of setting up care, a coordinated care with the patient and following through over a long period of time. You get to know the patient, they become a part of your family in a way, and I enjoy taking care of my patients and getting to know them.
I decided to become a rheumatologist because some of the diseases are just so fascinating. One disease can cause multi-organ system features, particularly in vasculitis or a disease like lupus. It can cause a kidney involvement, lung involvement, brain involvement, and as well as joint involvement. And that's just fascinating because sometimes it's hard to figure out which one it is.
We're the last independent, non-hospital affiliated rheumatology practice left in Greenville, or at least group practice left in Greenville. And that's something that we're somewhat proud of, that we're still able to stand on our own.
We have a website that allows the physician to get quick referral to us, so that in general the patient with inflammatory arthritis can be seen within 1 to 2 weeks of the referral from her physician. Hopefully the patient will see your physician and then be referred to us within 4 weeks of the onset of their arthritis. I had a patient in the other day who's 27 years of age, and she had her 2-year-old daughter with her, and I told her that the daughter made me feel older, and she said, well, why is that? And I said, that's how old you were when I first started to treat her.
My parents knew something was wrong when I was a toddler and I was walking as a normal child. My legs started to draw up as they would. I started to perform a limp when I was probably 9 to 18 months, between that range, and they knew something was wrong. They started seeing multiple doctors. They ran tests for this, that, and the other. They just could not pinpoint what it was. They actually performed surgery on me. I was 18 months old, I believe. Performed an exploratory surgery on my left knee and could not find what the issue was causing me to draw up and cripple. The blood test came back as juvenile rheumatoid arthritis when I was just over 2 years old. My daughter's very active. She's up and down all day, complete opposite of what I was when I was a child. And it's a lot to keep up with her. So the medicines that I take allow me to do that. But I feel that the medicine that I'm on now, the shot that I take twice per month, every 2 weeks, I feel that it's going to slow it down. I have to hope that it will, because I'm not hurting nearly as much. We've actually stopped or lowered some of the doses of the medicines that I take, where that one's kind of like the one that's going to keep me going throughout my life, that'll help keep my joints from being inflamed, keep my muscles and stuff from being stiff in the mornings. I'm able to get up out of the bed and be able to actually walk to the bathroom, walk to the kitchen, wherever I need to go, take care of my child, without anything slowing me down now. And I think truly think that's because of the medicine being in my system.
So even though the disease process can last a lifetime, we still, with the aggressive treatments we have available, can prevent damage and allow the person to have full independence during their lifetime and not be hurdled or held back by their arthritis. It's like coming to a university related practice, in that we do the research here, we do the therapy here, we have excellence in defining that your arthritis is under appropriate control.